Well, we again know that CoQ10 is important. This is again from neurology. These results, this 48% reduction decline, suggests that bioenergetic therapies like CoQ10 may have the potential to affect the course of neurological diseases in which mitochondrial function is impaired and oxidative stress and damage are present. That is every neurologic degenerative disease that has a vowel in its name. Those are the ones that they're talking about. And again, here is the study that they did, and here's the decline. That group getting 1,200 milligrams decline. Their rate of decline, you want to be lower on this scale, the Unified Parkinson's Disease Rating Scale. This is a group getting a large dosage, I would agree, of CoQ10. Their rate of decline was dramatically reduced. And here's what they concluded. They've got CoQ10 treatment in high dosage. It is safe. It is well tolerated, and it reduces the worsening of Parkinson's disease as reflected in this score. And therefore, here's their conclusion. It is premature to recommend the use of CoQ10 in the treatment of Parkinson's disease. Breathtaking, isn't it? Well, this brain of ours is a very fragile organ. Fat is very susceptible to being damaged by free radical activity. That's why so many of the antioxidants that we take, vitamins A, D, E, K, are what we call fat-soluble. Things like alpha-lipoic acid is a very powerful fat and water-soluble antioxidant. Because we have to protect the fat of your brain. Your brain is 70% fat. And of that fat, 1/4 is a type of fat called DHA. But because it's fat and because it has a high level of metabolism, the production of these free radical chemicals and the damage to the tissues is very likely, very possible. That's why we've got to do everything we can to protect the brain. We don't want to deplete coenzyme Q10, do we? And here are some commonly used drugs that will reduce your level of CoQ10. Many of you are familiar with the fact that statin drugs reduce CoQ10, right? If you're taking a statin drug, you should be taking CoQ10. But in your handouts, you have this information. It's also in the Better Brain book. Drugs that will reduce your levels of CoQ10. So it's very, very important. Put that down, you fool. It's a bone of contention. Vitamin E, a very important brain-related antioxidant. Studied and published by the Archives of Neurology, July of 2002. They looked at vitamin E consumption and the risk of cognitive decline, and they found that the risk of decline was reduced by about 36% in people with the highest levels of vitamin E. So vitamin E is a very important brain-related antioxidant, like NAC, like coenzyme Q10. And we'll talk about dosages in a little bit. I mentioned homocysteine, and I mentioned it because it's very important. Homocysteine dramatically increases a person's risk for Alzheimer's disease. It is easily measurable, and it is easily treatable. When you go to the doctor, you need to have him or her check your homocysteine level, along with your C-reactive protein, and one time your ApoE status. This gentleman comes in saying, I think I had a stroke. When a person tells you that, chances are they're correct. He had a radical prostatectomy in the past. He has had some, quote, mini strokes, which I kind of object in terms like being somewhat pregnant. He has a history of hypertension, which is a risk factor, and he's taking some medication. Blood thinners, a drug to thin his blood, and then Prilosec, which is an acid-blocking drug. Well, his examination, his blood pressure looks okay. He's alert and cooperative. He doesn't know the date. I had to ask that earlier in this talk, I remember. He doesn't know the year. He does know the month, that's July. He knew the name of the president currently. I'm not sure how to score that. He knew the number of quarters in $1.75. We gave him a test called the mini mental status test, and he scored a 21, and that's a sign of a failing point or something. That's pretty compromised. So, here's his brain MRI. And you see that there are multiple areas of small strokes that he indeed has had over time. After a while, these things add up, and you have areas of the brain that have been damaged in this way, and after a while, the brain just doesn't function well. So, we'll take a closer look at him, and what do you see? There's his mouth, and we look in the corners of his mouth, and we see that he's got lesions there, which we call angular, means it's at the angle of the stoma or the mouth, angular stomatitis. And typically that's a hallmark of B vitamin deficiency. That's a prediction of elevated homocysteine. You really don't need to do the blood test. When you see that, you know this person has elevated levels of homocysteine. He's B vitamin deficient. B vitamins keep the homocysteine level down. 16.6. That's a high number. I see it every day. Over 14, you've doubled your risk for Alzheimer's. I see 16, 18, 20 on a daily basis. No one's checking homocysteine. It's very important. Why would his homocysteine be elevated? Well, here are his medications, and here he's taking something called Prilosec. These drugs, Prilosec, which is an acid-blocking drug, used to be prescription only, but now you can buy them over the counter, right? Zantac, something or other, Pepsid AC. Because if you look at the commercials on the evening news, which is where I guess people get most of their information by watching television, you see some obese man in the aisles of a supermarket buying awful sausagey crap, and his whole family rushes around. Oh, he's going to eat that. And then just before he eats it, he pops the pill. You've seen it. I'm not going to say it, right? If you take the pill, you need whatever you want. So that's what people do. And people are buying, it's over the counter. What is it? It's a stomach acid blocking drug. Why do we need stomach acid? Did God put stomach acid there so that we can develop these drugs to block it? I think not. Stomach acid does many things. It begins the process of digestion. It activates digestive enzymes. And it allows your body to make something called intrinsic factor. And I don't mean to be too technical about it, but intrinsic factor is, when it's activated, is how we absorb vitamin B12. People who have low levels of intrinsic factor develop something called pernicious anemia, which is a deficiency of B12. It has brain dysfunction characteristic, and also changes in red blood cells. So he's on a very suspicious drug. It inhibits B12 absorption, ultimately. Well, why is this homocysteine so important? Again, published in the Annals of Neurology, this study looked at the relationship between elevated homocysteine and these silent brain infarcts and white matter lesions, these brain strokes. The overall risk of having a silent infarct or small stroke that you never even knew you had, or white matter lesions, multiple small strokes, is strongly associated with homocysteine levels. The risk of having a stroke and you didn't even know you had it is 250% increase. How do they know? By doing MRI scans. The risk of having both of these is dramatically increased. So homocysteine levels, anything over 8.5 was used in this study as having so-called elevated homocysteine. First time I checked my homocysteine, it was 8.6. So it should be lower. Vascular dementia, they say, is the second most common cause of dementia in the elderly after Alzheimer's. They coexist. You really shouldn't segregate the Alzheimer's patient from the vascular dementia patient. But this study shows that having elevated homocysteine is a powerful risk factor for brain degeneration, and it's easy to fix. We speculate that progression of vascular dementia in patients who identified elevated homocysteine could be prevented by vitamin supplementation. The Lancet from Britain publishes an article saying we can prevent vascular dementia in people with elevated homocysteine by giving them the V word, vitamins. Caramba. So we look at B12 levels and folic acid levels also involved with homocysteine. We find that the levels of folic acid are much reduced in the Alzheimer's patients versus control. Again, folate lowers homocysteine. Homocysteine levels are up in the Alzheimer's patients, much greater risk. Here's the overall play, and that is with the plasma homocysteine greater than 14, the risk of Alzheimer's disease doubles. Okay? And I'm going to tell you right now that probably 20 to 30% of most audiences to whom I speak have homocysteines at that level or greater. I don't mean to pat you too much on the back, but just looking how healthy everybody looks here, it's probably less. But in general, in our population, this is a profoundly treatable cause of increasing risk for Alzheimer's. People need to know what their homocysteine levels are, because it is a time bomb. Published in the New England Journal of Medicine, a wonderful review of homocysteine in the brain. We don't want to deplete folic acid because folic acid helps to lower homocysteine. In your handout are drugs that deplete folic acid. Some of the most commonly used drugs that you see, including aspirin, Celebrex, non-steroidals, hydrochlorothiazide, and obviously the acid-blocking drugs. B6 is involved in homocysteine metabolism. At your leisure, you can look through that list. And drugs that deplete B12, you should look through that list as well.